Do you need to take vitamin K2 with your vitamin D supplements?
Like a synergistic effect or something?
A lot of people think you do.
Okay, well, let's figure it out.
Okay, welcome to Talking with Docs. I'm Dr. Brad Weening.
And I'm Dr. Paul Zalzal.
Okay, so today we're going to talk about vitamin D, which is a very common topic. We're actually going to do another video later on about some of the dangers of vitamin D because it's not as safe as everybody thinks. That's the first thing.
No, in big doses, it can be
Big
dangerous.
doses can be dangerous. And then we're going to talk about vitamin K and how they work together to do a bunch of different things in our body.
Okay.
I see what you did there.
All right,
let's start at the beginning.
Okay, so K. When we talk about vitamin K, we're talking about vitamin K1 or K2.
Right.
But don't get this confused with
K, which is potassium.
Potassium, right?
Right, so don't get confused with the element on the periodic table. I think 19?
Possibly, but its symbol is a capital K.
A capital K
That's
with a
where the
little plus
confusion-
sign.
Yeah.
Right? So we're not talking about we're not talking about potassium, we're talking about vitamin K, which is a fat-soluble vitamin. We've talked before, there are four of them, A, D, E, K, or ADEC.
Problem with fat-soluble vitamins is they can store up and build up in your body if you take too much of it.
Right.
Unlike the non-fat soluble vitamins that you're excreted in your urine, so you can take as much as you want and you'll pee out the excess.
Right.
Not the case with A, D, E, or K.
Not the K.
Right.
You did it
That's
again.
pushing it.
Okay, so K1 is the one that's most common. This is the one that we're familiar with. And this is commonly found in green leafy vegetables and cruciferous vegetables. So you can imagine people that have a high consumption of these foods often have better health indices and are going to have vitamin K levels that are okay.
Right.
Interesting about vitamin K, another thing within medicine, is that it relates to your clotting factor. We've talked about this before, that German word coagulation. So people that are on warfarin or Coumadin, typically for something called atrial fibrillation to thin their blood or prevent it from clotting, have to be careful with their vitamin K consumption.
Right. And as residents and because and early in our careers, we used to administer quite a lot of vitamin K.
A lot.
Because a lot of people were using warfarin,
Yes.
which is rat poison, also known as Coumadin, to thin their blood if they had conditions that needed it to be done, like you mentioned, atrial fibrillation and that. There are newer anticoagulants now indicated for those things, so we're seeing less and less and less people on warfarin. However, when someone came in on warfarin, their blood was thin, but we had to do surgery on them. So to reverse it, one of the ways we would reverse it was to give vitamin K, IV or orally. And because it competitively inhibits, they compete with each other for receptors. So if you're on warfarin, you've depleted your vitamin K. And so we used to give vitamin K to counteract the warfarin so that we could operate on them and they wouldn't bleed excessively.
Yeah, and competitive inhibition is kind of like two people having a key and trying to get to like a lock. And if Coumadin's there, vitamin K come in and kind of push it out of the way or assume the position of that lock to help your blood coagulate normally. Because obviously we can't do surgery if people don't have the ability to stop bleeding.
Competitive inhibition, which is what we often try and do with each other when we're trying to say the same thing on a video.
That's right, push it out of the
It
way.
happens. It
Now, let me
happens.
say it. Yeah. Okay, so that's mostly the K1 side. So K2,
Because it's not confusing enough. You have to come in with the K subscript
Well,
2.
wait. So K subscript 2, there's actually like 10, some people would say even 12 different types of K2.
Okay.
So there's two important ones that you'll see a lot on videos like these or on other research. Number 4, MK4, and MK7. And K2 is called menaquinone, and K1 is called
You're
phylloquinone.
so good with the big words.
They really like the big names. So MK4 and MK7 are the ones that are thought to be most responsible for the health benefits that we're going to talk about. So before we do that, where do we find K2? Can we find it in our diet?
Yeah, we can.
Really? Okay. Where?
This is one where the chicken wing may have a role. Chicken has a high concentration of K2 compared to other foods.
Right. So particularly compared to pork and beef. So in the meat category, the chicken wing is better. But things like cheese and butter and eel, and then a fermented soy product called natto. Apparently, it's not very good to eat. A lot of people talk about how it's slimy and tastes weird.
Yeah, I like to put that on my eel when I eat the eel.
Yeah, that's right. And then the last one is other fermented foods like sauerkraut. So the trouble with relying on animal sources for this is that as mammals, what happens is they take in greens like grass, and then their bowels convert them through bacteria and a very specific enzyme that converts the K2. But because more and more animals are being fed grain as opposed to just grazing around, their K2 contents are going down. So that makes it a little bit tricky.
And that's why I only eat the chicken wing from kale-fed chickens.
So yeah,
It's hard to find.
Yes, interesting. 1 cup of kale actually has all of your daily requirement of vitamin K, which
And
is
zero taste.
that's right. It is the RDA for vitamin K is actually 90 to 120, depending on male or female. And they actually don't specifically address the RDA for K2 because a lot of research does not necessarily show a specific benefit at this point.
Can you measure K2 in the blood?
So very good question. There's not a reliable test. So if I'm a supplement company, I'm pretty happy about that, saying, listen, I think your K2 is low, why don't you take the supplement?
Yeah.
How do I know? Well, you can't test it. There
at-
are some indirect ways to test K2 levels, and that's carboxylation of osteocalcin. But because if you have a bunch of osteocalcin that's around and not carboxylated, then some people say, well, that can translate into low K2, but there's not a good direct test. So this is one of the plights of the whole K2 argument, really.
Right.
Okay, so what does K2 do? What does K2 do different than coagulation? What's the purpose of it?
K2 helps you regulate the calcium in your body, right? It helps you and calcium in the body is stored mostly in the bones.
Yes.
And we like it in the bones.
Yeah.
It's not so great if it gets out into the bloodstream and it gets very high levels of calcium in the bloodstream because that can go into your arteries, that can cause plaques, and that can contribute to atherosclerosis, heart disease, stroke, and all those vascular diseases that we talk about.
Right. So vitamin D gets that calcium up when it's consumed with fat, gets that calcium up into our bloodstream. And we talked in another video about how calcium supplements cause high spikes of this, and that's an issue. But what happens is there are two proteins called osteocalcin and matrix GLA protein where they require vitamin K2 to carboxylate them and make them active. And this helps promote calcium going into the bones and actually out of the bloodstream into the bones rather than sitting in those vessels or calcifying the walls. Because we talk about arterial stiffness being an issue and calcification of the plaques being an issue.
So you can see those two good things because if you have osteoporosis, you have poor bone mineral density, increasing the calcium in the bone, helps that strengthens your bone and helps you resist fragility fractures. And at the same time, getting it out of the blood keeps it out of your arteries.
Right, so those seem like really good things. Obviously, everyone should take vitamin D and calcium and K2, right?
Well, that's the problem. we know some of the mechanisms that happen, but so much of the time we know mechanisms of things, and then when we go to translate to health benefits, that's where the link is broken.
Right.
And you can say, oh yeah, we see all the biochemical things that happen, so if we just give a supplement, less people should die and less people should break their bones. That is what we're having difficulty proving, especially with K2.
And a lot of the studies for K2 particularly are observational studies, so where they assess people's dietary patterns and sometimes they'll give them supplements. And a lot of these studies are sponsored by the supplement company. So K2 supplement business in 2022 was about $700 million, estimated to get to $2 billion by 2030. And a lot of it is driven by social media and videos exactly like this, where people be like, hey, click on the link and get 10% off my K2. Brad and Paul's K2.
That's right.
We do not have any of those types of products or sponsorships. And that really complicates the landscape. So observational data where you say, well, look, this group of people, we think they look like this, and they don't have this, so it's because of this. Well, here's an example.
Give us an example.
So if you're watching professional golf on a Sunday, you say, well, these guys all have long pants. They got shoes with little spikes on the bottom. They're wearing a golf shirt. They have a hat. They're professional golfers. Well, if I put on a hat and a golf shirt, a long pair of pants, and some golf shoes, that does not make me a professional golfer. It makes me look like a professional golfer, but I'm not a professional golfer. And that's the difference between observational research and a randomized double-blind controlled trial in a human, which is the gold standard. So until you have that, you can't really say definitively that something has proof. However, it doesn't mean that K2 does not do this stuff. It just means that we can't prove it definitively at this point.
These observational studies are one step up from observational humor, Jerry Seinfeld style.
Right. I like Jerry Seinfeld.
Me too.
So if you go to PubMed or the National Library of Congress where they document all the papers and the research articles, if you limit it to randomized controlled trials, it comes up with actually 15, and all of them are about bone right now.
Right.
So when you're doing K2 and D3 together. And so what does it show? Looking through all of them, my takeaway is that the one group of people that has shown to benefit from K2 and D3 together would be postmenopausal women with respect to osteoporosis and bone quality, bone density. But it does not necessarily reduce the incidence of fractures.
Right? That's the thing. We can see biochemical effects, but we can't translate it into a good clinical outcome. And that's like many of the supplements.
Right.
But there are some people in cases where we do administer K2. We talked about vitamin K1 we give when people came in on warfarin with the thinned blood, and newborns as well.
Yes.
Often will get a K injection as well because it doesn't cross the placenta very well. And there may be medical conditions that you are on K for those medical conditions prescribed by your family doctor or your healthcare professional. And that's fine. We're talking about supplements for the average person with no significant related medical conditions. Should they be taking vitamin K?
Right.
Can we go to the bottom line yet, or are we there?
No, not yet.
Okay.
With respect to the cardiology side, so things like arterial stiffness, calcification of the aortic valve, as well as calcification of the vessels themselves, a lot of observational data, no good, solid randomized controlled trial to prove this. Actually, recently there was a trial for aortic valve calcification that did not show a difference. That was very disappointing for a lot of people who thought certainly it was going to. And there are specific populations where the incidence of valve calcification is very high, particularly renal patients and dialysis patients. And they've done some studies in this group of people to say, hey, if we give them K2, can we suck some of that calcium out of their vessels? And it has not been proven. So I think there's more to learn about this. I think so I guess the take home for me is that taking K2, I think, has some potential benefits. I think it could help your bones at this point more than it can help your vessels, but we're not sure about the vessel side because a lot of the people that have healthy vessels are already eating healthy diets. Green leafy vegetables, cruciferous vegetables, wide variety of plants, as well as less animal products. This leads to better
that's my
health.
take home. That's now, after doing all the research and all these supplements, I go into it thinking, is this thing going to prove to me that this supplement is better than eating a healthy, balanced diet?
Right.
And then that's sort of the benchmark I set. And no, definitely K doesn't meet that requirement for me. Right. And if you think about it, why is there no double-blinded randomized controlled trial? It doesn't make sense that there isn't one, because the companies that make these supplements have a lot of money because it's a big industry. They could easily fund one of those trials.
Sure.
But you wouldn't fund one of those trials if you were one of those companies and not confident that the results would prove that your supplement
is
good. And then you should be a little bit weary that there aren't big randomized controlled trials proving these things.
That's right, and time's going to show, because there are a lot of ongoing ones, and like we said, there's been some observational data that's shown, like there's one that a lot of people quote, the Rotterdam study, where they've shown that people with high K2 intake do have less calcification of their vessels, but it's not an RCT, it's observational data. So the good news is vitamin K2 is very safe. So even if you took very, very high doses, the odds of it causing damage to you would be low unless you're on Coumadin. It does have an associated cost, but I think proceed with caution, and I think we'll keep our eyes and ears open, and if something else comes up, happy to share.
Yeah, and leave a comment if you have some experience or anecdotal data, or you agree or completely disagree.
But don't get mad, because people are going to get mad and say, well, I saw this guy, and he said I have to take K2. We're all about the randomized controlled trials, so show us the data.
Show me the evidence.
There, now you know. If you like this video, please like it, subscribe to our channel.
And remember, you are in charge of your own health. Just eat a good diet.
There you go. We'll see you next time.